Mommy Makeovers basically deal with the sequelae of multiple pregnancies. And as you know, pregnancy takes a toll on the lady. There are various areas which need attention. Most people have an impression that you can just operate in a couple of hours and reverse everything that has been the result of multiple pregnancies. Please understand that these changes that have taken place in the body are over a substantial period of time. We can't just snap our fingers and say that everything is going to be corrected. Now, what are the limits to procedures? What are my safety standards? I'll be very frank. I try to make sure that any surgery is not more than 4.5 to 5 hours. I believe that the longer the surgery, especially when the patient is completely under anesthesia, the longer the surgery, the greater the chances of post-operative complications. Therefore, if I feel that any surgery is going beyond 5.5 hours, if I'm combining procedures, I like to split it up. Yes, I do understand that it can affect the budget of the patient, it can affect the stay of the patient, but I reiterate, patient safety comes first. Some procedures entail what is called as an obligatory blood loss. If you are doing a large tummy and you are removing a chunk of tissue from the lower abdomen, that itself contains a lot of blood and fluid. So, preoperative fitness and continuing fitness for the next stage are very important. So, to get back to my original topic of a mommy makeover, unless the deformity, I use the word deformity, is very mild, inevitably it leads to multiple procedures. And this is what patients need to understand, that the reason we are staggering the procedures is simply for the safety of the patients, not for our convenience. And as long as this is understood, it may entail a longer duration of the stay. Sometimes there are procedures which need to be staggered for best results. For example, if you have a patient with a very large tummy because of a lot of fat, it's a little risky to combine extensive liposuction with a tummy tuck. Yes, they can be. Liposuction is almost always a complement to a tummy tuck, which is why it is known as lipoabdominoplasty. But there are certain safety limits which I do not cross, and if I feel that the volume of fat is simply too much, I have recommended in the past that we do it in stages. Again, keeping in mind the idea of getting the best possible result with the safest possible procedure.